going to get started. Our first organization is the Pemberton and District Public Library Association, and I am just trying to find our speaker on my screen here. It's Emma Gillis. There you are. So, I'm going to put Emma up on here. Unmute, and there you go.
This is somewhat nerve-wracking, especially going first. Thank you all for actually inviting me. It was such a wonderful surprise in my inbox, especially given the year that we're having so far. So thank you already just for having me here this evening. There's a famous quote by an American writer, Anne Herbert, that libraries will get you through times of no money better than money will get you through times of no libraries. And while I certainly have an abundance of quotes up my sleeve highlighting how libraries are more than just books, this quote has never seemed more relevant than it has this year. So hi, my name is Emma Gillis and I am the Library Director of the Pemberton and District Public Library. The library serves a population of approximately 6,000 people, spanning the service area of the village of Pemberton and Area C of the SLRD. So that's a service area of approximately 5,600 square feet. However, through membership of Federation known as Interlink and a provincial programme known as BC One Card, we offer reciprocal services for anyone holding a valid BC Library card. With the special makeup of the Sea to Sky corridor, we also work closely with our neighbouring libraries in Whistler and Squamish to share resources and really just try and provide a streamlined service for our communities that all live, play and work together. We meet regularly to try and find new ways to innovate and share resources with each other. The library's mission is to be a place to connect and inspire through ideas, programs, resources and technology. We've had to pivot and adapt quite a lot this year as we've had to restrict access to the physical library space, but still ensure that we're providing barrier-free access to resources and those connections that are so crucial in a small community and in all of our communities. Now more than ever, libraries are really playing a crucial role in that mental stimulation and social connection that we're all craving and needing. In addition to the core library services of free access to library materials, we're constantly striving for ways to connect and engage with our community through innovative events and programs for all ages. In addition to being an affordable way of accessing reading materials and other leisure and learning opportunities, we are a crucial service for many for free internet access, computer facility access, and above all, we're one of the only places in any of our towns that you don't need to spend any money to go there. And in pre-COVID times, you could hang out there all day if you wanted, but sadly not so much at the moment. We're slightly different from the Whistler and Squamish libraries in that we're not municipal libraries, we're a library association. Our annual operating budget is approximately $400,000 and the majority of our operating funding comes from the village of Pemberton and Area C of the SLRD. We also receive some grants from the provincial government and we generate a small amount of revenue through activities inside the library. Special projects and capital purchases must either be sourced through wonderful grant opportunities such as this or fundraising. And previous fundraising efforts we've had have included the very popular wine and cheese that ran for about 25 years and more recently Oktoberfest. But sadly limited resources and now a pandemic have meant those fundraising opportunities are no longer feasible for us. As a publicly funded organisation, the needs of our community really drives our focus and decision making. In January of this year, we launched our 2020 to 2023 strategic plan. And one of our key strategic areas is to inspire minds through literacy and learning. The goal of this is to embrace creative approaches for learning opportunities that will broaden horizons and inspire curiosity through expanding our non-traditional resource lending opportunities. So what does that mean? Presently, we loan out such items that are considered non-traditional, such as board games and e-readers, but our goal is to expand on this so-called library of things, as it's been branded, with a mobile maker space that we're referring to as a creation station. And this is what we would hope to use the funds for should we be the successful applicants of the 100 Women of Whistler donation funds. So what is a creation station, and why this project? Well, many libraries are expanding into creating inspiration labs, and they're also really expanding into lending tech opportunities. The one thing with the pandemic that it really highlighted is that there's a huge digital divide in our communities, and not everybody has equitable access to these learning opportunities. Also, with the limited space in the Pemberton Library, we unfortunately do not have the luxury of a separate programming room. So a mobile makerspace that we're thinking of would allow us to expand on our STEAM-based learning opportunities without that need for a separate room. Many of the items we would be adding to it would be available to borrow and try at home, be available to borrow in Pemberton, and also with Whistler and Squamish Library cards too. And as I said, the onset of the pandemic just really highlighted the digital divide in the community, and to be able to provide access to these resources in a meaningful way would really be very impactful to our communities. The other beauty of this is that it can be accessed by patrons of all ages, and it would provide access to learning opportunities across a range of things such as 3D printing and design, robotics and coding, video and music creation, and the one we're actually most excited about is textiles and wearables. So what would that look like? It would be things like a 3D printer, lendable laptops or tablets with software that people typically couldn't afford to buy themselves on it. So if they wanted to do any kind of design or any kind of 3D modeling or anything like that. We'd also look at lendable robots so that anybody can learn how to code and have fun doing it. And the other things that we've thrown out there as fun ideas was that we could have intro to knitting packs. It could be anything to do with needlework. There could be screen printing. The whole idea is that there is no limits to this station. As long as it's around creation and innovation, we would expand it as far as our communities were interested in having it expanded. And everything would be accessible to anybody with a valid library card. So really the way we see it is the possibilities are endless in terms of providing access to trying new creative endeavors that would otherwise be cost prohibitive. The beauty of the station is that once we have those foundational pieces, we can continue to add and expand to it each year as new opportunities arise, or we respond to things that the community is really interested. You know, if there's suddenly an increase in people wanting to crochet, then we could look at that. There's lots of different ways we can expand on that. This is really an investment that will last for many years to come, and it would become a part of our core programming, particularly for youth, which is one of our hard to target areas. In addition to the physical station itself, we would also be using the funding for a speaker series component. We would maximize local sea to sky expertise to connect the community through online learning opportunities, and each lendable item would correspond with a live event with a sea to sky expert. These sessions would be recorded and made available for everyone that wanted to watch them afterwards, and it would also connect them with the resource they can then borrow afterwards. We would then hope that once the world returns to some form of normal, these events could be repeated in person and then build on that connection that we're always trying to foster. We would be using the Creation Station to build on existing programs that we've already had. We've run a maker program for after school kids for quite some time. Again, hasn't happened this year due to the pandemic. But it would really also help us connect with the underserved teen population, and also open up fun family literacy opportunities with a petting zoo style program that the whole community can access. There's lots of various ways that we could really implement this this particular service. The products we add would be entirely new to us, so that would be the new component, but we would be also then connecting them with a speaker. And then in terms of monitoring the success with all our programming, we track attendance, we gather feedback, and we always try to make sure our outcomes are being met. But regardless of attendance at any event, the most exciting part of the program for us is to generate that curiosity, provide access to new learning opportunities in a barrier-free way. Sort of to sum up, like an example of some of the impact this can have, last summer we had a summer reading club, and we had very simple devices called Makey Makeys, which very few people had seen. Very simple, very affordable, but we had them set up as a summer reading club activity for families. And these are essentially little electronic circuit boards, and the kids had to come in and they had a challenge where they had to take these circuit boards and turn some pieces of fruit into musical instruments. And it was just amazing to watch how they figured it out, and their parents were with them and they talked about it, and then they went away buzzing because they'd like turned a banana into a piano. And just those little things that you think, oh, it's technology, but the way that you can see the impact and the connections it can have, and how it just fosters conversations, was really, really heartwarming for us. And we got a lot of really great feedback for that. Another really good one we did a coding workshop. And I remember a father distinctly coming up to me afterwards and saying, that was great. It was just, I sat and learned something with my son and we really bonded over it. Like, I didn't know anything about coding either. We both learned something, but we learned it in a way that just, it was accessible, it was free, and it's not something that we would have probably paid to do beforehand. So I just want to say that I know it can seem like technology, and a lot of people are, how does technology connect us? And as we sit on a Zoom call, obviously, but just really these things can have really great impact and give people that mental stimulation and the desire to learn something new. So I think that's essentially all I have, but I do want to finish by saying that I'm incredibly grateful just to have even had this opportunity tonight. Thank you for taking the time to actually listen to our proposal. As I said, we've seen firsthand the great impact access to these unexpected things through the library can really have, and I know this could have a lasting impact for all of our communities and connecting and inspiring us for years to come. So thank you.
Thank you so much. Andrea, can you unmute yourself there?
Yeah, can you hear me?
Perfect. All right. So if anybody has any questions at all for Emma, just pop them in the question box here. We'll just give a minute, sorry.
I have a question directly to me that is there an age group that you think will use this new technology more than others?
Oh, great question. Definitely in the initial stages, we would see it would definitely be in the 7 to 12 group, but we've already been talking about great ideas. If we go ahead with a 3D printer, this is going to be a way for us to connect with teens and get them back in the library and back engaging with the library. We've talked about things like making Mandalorian helmets, like things that could be so cool, but they're actually learning great things at the same time. And honestly, there is no limits to the age group. We're kind of really hoping that it's going to foster more family literacy, that the kids are going to come in, the parents are going to come in with them. It'll be more of a family activity. They can take the things home, learn about them together. There's also going to be great, I know the seniors are going to be really interested in it too. We would do petting zoo, open house type events where anybody could come along and sort of try them out, or obviously during the pandemic it would be a little bit more controlled and maybe by appointment. But yeah, I think definitely the school age kids and the teenagers would definitely be a big focus. But the beauty of this is, especially if we go down the route of the more creative stuff, that's open to anyone. Like if there's somebody that wants to learn to knit, we can provide the materials. There's no cost outlay for you. We will provide the expert, and there'll be a Zoom knitting class. That's just thinking of a very simple idea that we can do with it, but it can be as big or as small as we think it could get.
Thank you. And then there's another question here. Do you have specific items that you would like to buy with the money if you get it?
Yeah, the first thing we would need to get is actually the cart. That would, because as I said, we're a small library. We don't have a separate room. We've kind of priced up the sort of carts that you need. You can get all-in-one stations that actually then fold out to be a workstation as well. That would be one piece we'd need. We would love to get a 3D printer, just because it's something different. But we would, if there was something that we felt was more need, we would set that back. Like it's one of those things that can feel gimmicky, but if we program it in the right way, like it's more about, it's not about the end product, it's about how you actually create that product in the first place. And that's what's going to get people really excited. I think, the fact that they've made this from nothing. And yeah, so the 3D printer, we would probably want some tablets or Chromebooks or something that will have software installed. And then we were going to get a selection of the robots. They're like the Sphero Sparks, which are the really popular ones, particularly in libraries, because they're so durable. They're really simple to use, and they don't need a huge amount of tech support with them. They could be loaned out, and then they don't get that, they're pretty robust, so that we wouldn't have the sort of issues with any kind of repairs needing done to them. We've looked at things like, getting a sewing machine. We want it to be as broad as possible. We don't want to just be focused on tech. This is a maker station in whatever format, but those would be the big key items, the expensive ones. And then we would sort of look at it from there.
Thank you. And then next question, while this funding is going towards creating this program, how will the library be able to fund this moving forward?
So once we've got all the equipment, we have the staff resources to make it happen. So we have staff that are really keen to do programming around this, and that's how we would maintain it going forward. In terms of any kind of maintenance is needing done, we've kind of got the staff in-house to do that as well. So for us, the big expense is actually getting the equipment in the first place. Once we've got it, there's very little overhead cost for us other than staff time and promoting events that we put on.
Thank you. And how long will each item be lent out for?
That's something we can really decide. It could vary. It depends on the item. I guess the likes of a robot, we'd probably do maybe 3 weeks, but we would have to look at demand first, because if it's going to be that 60, 70 people are waiting for one, is it really fair that somebody has it for 3 weeks? So that's something we haven't quite got to the nitty gritty of that yet. That would really, but the likes of knitting needles, if that's what we went down, then that could be a couple of weeks as well, but probably anywhere from a week to 3 weeks, depending on the item and depending on the demand. We could even scale it back where we've got some that are like express borrows that you get for a week. So those ones keep turning over. And then we would have other ones that are more core. These are the ones you can take home and keep for a little bit longer. For example, our board games, we loan out for a week, but we allow them to be renewed if nobody's waiting for them. So we can be as flexible with the borrowing policies as demand dictates.
Great, thanks. And do you have a target amount of funds you would need to launch this creative maker station?
When we first priced it up, we were looking at around $10,000 to $12,000.
Okay. And then I've got somebody asking if you could please repeat how you are funded differently from the Whistler Library.
So the Whistler Library is a municipal library. They're a municipal department. We are so as a public library association, although we're funded by the Village of Pemberton and the SLRD, we're not a department. So we don't have access to a finance department or an HR department, or, a lot of the stuff that would be done within a municipal library would be done through the municipality. We have to either do that ourselves or outsource it. So we are not shown as a line item on the Village of Pemberton's budget. So we're funded by Pemberton Valley Utility Services. So that's partial funding from the Village of Pemberton and partial funding from the SLRD. And that's essentially how we're funded. And I'm governed by a board of directors, and I report to them, but we're not a municipal department, is essentially the main difference. So a lot less. We're more of a charity / not-for-profit than if we were municipal.
Right. And I think we answered this one. What is the total cost? Is that the same as the 10 to 12,000?
Yeah, and I think that the other thing as well, like this would be for us to get, a good core, solid. We could achieve a lot with $10,000. Like this would be phenomenal. And as I said, each year we could add to that. And I've just actually seen there's a question about donations, because that was our next plan, was that there are things like when we did the board games, we did a call for donations of board games in good condition. So I know people ask us all the time if they can donate e-readers to us as well. So this would really, once we've got somewhere to store this stuff, it's kind of limitless where we could go with it. But yeah, the $10,000 would be what would get us a good core functional setup that we could then run with and build on from there.
Do you have somewhere to store them?
We have somewhere that we can store the cart. So the part of the funding would need to be to actually get this custom cart. They call them like maker carts. They come in all sorts of different shapes and sizes. They've got storage units. Some of them have like flip top tables, so you can actually just wheel the cart out. They use them a lot in classrooms, I think. And that way we can store everything. It can all be locked. But then when it's being used for a program or when it's being loaned out, we can access it. Some of the even more fancy ones, you can actually like charge the devices and stuff in the station. But yeah, we've got somewhere to store a cart, just not somewhere to, yeah, it's limited space.
Perfect. Well, thank you so much. That was great. I think that's it for questions there. All right, we're just gonna hop on over to, sorry, it's gonna take me 1 second. Where are you, Sandra? There we go. So now we're gonna hear from the Whistler Healthcare Foundation. This is Sandra Cameron. This is the board chair. So just give me 2 seconds, Sandra, for it to unmute you. There you go.
Good evening, and thank you everyone for joining us tonight and inviting us to present to you. Trauma rooms are those specialized rooms in the emergency department where critically ill or injured patients are taken for immediate medical care. Our 25-year-old trauma rooms at the Whistler Healthcare Center are in urgent need of getting upgraded. So good evening, and I'm Sandra Cameron, and I'm the chair of the foundation. And tonight I'm here to appeal to you to help us raise the funds that we need to make the necessary upgrades to the trauma room. The budget for the full project is $1.5 million. And by December 15th, we need 90% of those funds, so 1.35 million. And that's so we don't have any delays. The projected start date is the spring of 2021. And to get that rolling, we need the funds by December 15th. To date, we've raised about 1.2 million, and the push is on to raise the remaining 150 by December 15th to make sure we can make the necessary upgrades to the trauma room. At this time, I'd like to call on one of our amazing healthcare workers, and she is the medical director for the Worcester Healthcare Center, Dr. Fern Vandenporten. And she's going to talk firsthand about what it's like to work in our trauma rooms and why the necessary upgrades are needed, and just tell you a little bit more. So Fern, can you join us?
There she is. Give me 2 seconds. There we go.
Hello, can you hear me? All right, awesome. It's nice to see everyone. I've met a lot of you because I'm one of the members of this group, and it is really nice to be able to have a chance to talk to you today. I know a lot of you personally. I've seen many people as patients, but I'm just on gallery view right now. Will you guys give me a wave if you've ever been a patient at the Worcester Healthcare Center? Wave. And if you're one of those people not showing your face, how about the thumbs up or one of those reaction symbols? Very interesting. It looks like almost all of you. Now, what about somebody that you know or yourself? Have you ever been treated in our trauma room? That's like Sandra said, the room where our sickest people are cared for. It does not mean that you are having a trauma. You could be having a heart condition. You could be critically ill with a respiratory illness like COVID. Give me a wave if you've ever had the experience with yourself or someone that you know having been seen in that room. I'm just scrolling through all the faces. It's a lot of people here, a lot of people, and it's not a surprise. It's a heavily used room. We see over 1,000 people a year in that room, and it's a small space. We've put pictures in the newspaper trying to show you what it's like to work in there. And 25 years ago, when I was just entering medical school, that room was probably a good size. It had less technology in there. There was a bed, and there was some suction, and there was a ventilator, and that was about it. And now, as technology has changed, we have all of our computers are on wheels, we ultrasound people in that room, we x-ray people in that room. And so we have this space where it used to be big enough, and it isn't anymore. We go in there and we are challenged. Not only are we challenged to save your life or the life of your family member, but we're actually challenged to physically work in that space, because not only are we physically running into one another, but we're also climbing underneath cables and lines and IV tubes. And, you know, it's really a hard place to work. So I love working there, don't get me wrong. It's exciting and amazing to do what we do, but we need to do better, and we need to be with the times, especially given how much acuity and volume we see, and also the aging population. So even though we walk around town and there's a lot of 20-year-olds, it's a lot of older people here. It's our parents visiting, it's ourselves. And as we get older, we have medical conditions that complicate things. So a laceration is not just a laceration when you're on blood thinners. It could be a hemorrhage that ends your life. So we need that space to have every possible chance that we can save your life and give you the very best down the road. So you might think, $1.5 million, what's $10,000, what's $11,000? It's huge. We're at the very, very end of our fundraising. We are so close. To get this thing rolling, we need that last little bit. I even made all of my coworkers donate $500 the other day. I'm like, everybody, this is for real. This is really, really important. This is a critical time where the health authorities have no extra money. I mean, millions of dollars are flying out the door to COVID, not by anyone's choice, but just because we have to. We're just doing damage control every day. So if we want this project to happen, $0 are coming from Vancouver Coastal Health, $0 are coming from the health authority. This is something that we as a community need to do for ourselves. So I really am so hopeful that you can help get us ever so closer to that goal that we need to get this rolling in the spring. So thank you for listening, and it's nice to see all these faces without masks on.
Thank you so much.
I go in.
If anybody has, oh, sorry, go ahead, Sandra.
Can I just close off for a minute?
Yeah, for sure.
Yeah, I just wanted to thank Fern and all her amazing team at the healthcare center. They do an amazing job every day, and the last 8 months have been that much harder. So I think we all need to show our support for them. They're doing a great job, and we need to support them and make sure they have the tools they need and the space they need to do their job. So thank you, everybody, for listening to us tonight, and thank you, Fern. And just thank you for letting us come in. And just want to appeal for your support. We need it. And like Fern says, we're almost there, and we just, every little bit counts, and we're hoping to make our December 15th deadline. Thank you.
All right. Again, if anyone has questions at all, we'll give it a minute. Pop them down in the chat box. Try to send it to everyone or to Andrea if you can. And Andrea, go ahead.
I have one question already. What kind of things bring children into the trauma rooms?
Kids are the masters of getting into trouble. So if you want to talk about trauma, I mean, bike park, skiing, falling out the screen window that wasn't secured properly, burning themselves, poisoning themselves, drowning. You know, it's endless in terms of how they traumatize themselves. And then also they get sick. So kids have less reserve than we do in some capacities, in particular, one, heat loss from being out in the cold, and the second is respiratory. So respiratory illnesses, unfortunately, are the cause of cardiac arrest in most kids' cases. So in terms of looking after our pediatric population, you know, we need adapted technology, and we also need, you know, a place to work. They're tiny little people, but, you know, you can't get enough people in the room to help those people when they come. That's for sure.
Second question is, what exactly is being done to the room? What will it look like after $1.5 million?
Ooh, I wish I could flash you the slides and plans right now. So give you a quick summary. If you know the space, the room that was the trauma room, and then this adjacent room, which was called the treatment room, the whole center is coming out of that. So it becomes a space that can be 1 or 2 spaces. Oh, I see one flashing up. Sandra's showing this picture. But really what we're doing is we're stealing a little side office to be our donning and doffing room, because now we have to get dressed up multiple times per patient in a special space. And then we're really combining that the suture room and the trauma room to be one big space. And so all the clutter for one will be removed. The booms, these things will come from the ceiling, and what they have is the suction IV lines, all that stuff, so that we don't have the problem with the wires coming off the patient to the wall everywhere. And then what we can do is we can either open up that center. So say it's a big trauma and we need, 8 or 10 of us in there, or we can put that divider back up and have it as 2 functional rooms. Also, the whole front wall is glass, so with a frosting at the bottom, so people on the outside can look in and see, what do we need, what's the next thing. We've added negative pressure, so if there is a COVID concern or an aerosol generating procedure, we can keep the rest of the patients in the building safe, and also keep it a very safe working space for the staff. So there's lots of stuff. So there's space for technology, and it's a safer place for patients and staff alike, and the other patients in the department, which is really important during these COVID times.
Great, thank you. And then next question, are there any specific pieces of equipment that tonight's donation will purchase?
Do you want to go ahead, Sandra?
Okay. Most of the budget is building, because it's a renovation. It's mostly changing, the building itself. There is the 2 booms that Fern referred to, and they're about $120,000. And then there's not a lot of other equipment. The other equipment is the equipment that they use already, and they just need the space for it. So most of it, unfortunately, goes into the non-sexy stuff in, drywall and wires and plumbing and tearing down walls and that sort of thing.
Hang on, we've all seen contractors. That is sexy stuff.
Thank you. And then there's just a comment here. If you don't win the donation tonight, if you could please share the link to donate.
Yes, well, whether or not we win, still please donate, and please tell as many people as you can who you think might use our space. But correct me if I'm wrong, Sandra, but it's at whistlerhealthcarefoundation.org.
Yep.
Okay, good.
And we will include with the email following this, announcing to all of our members a link for each one if they want to donate to it. So we'll provide that to all the members by email as well.
All right, there's a bunch of questions here, so I'll keep going. What happens if you don't make the deadline?
Well, Vancouver Coastal has put that to us. It could delay the project because we're 100% financing the project. They want to make sure that we have the capability to pay for it. So it could delay the project. It would depend on how Vancouver Coastal and how close we are to our goal. Would depend on their decision. I mean, if we're at 1.34, they probably would go. If we're still at 1.2, they might go, yeah, we want to see some more money. So they need time to get things going. And spring 2021 isn't that far away. And we need to get started in the slow season so that they can have as much time when it's not busy to get the project done.
Great, thank you. And if you get the $10,000, what other plans do you have to make up the remaining $140,000 before the deadline?
Well, everybody runs now when they see me or see an email from me, because I've been reaching far and wide, as have our whole board. We have a few people that we're waiting for answers from, but we're pretty confident that we're going to get there. But we have to have, like Fern says, every little bit counts, and $10,000 is a lot of money, or 11,000. So it'll go a long ways to just bumping us up a little bit. Blue Star Financials put out a challenge to local businesses to match their $10,000 that they just donated. So we're still working hard at it. We've been working hard at it for about a year now, and we'll just keep going until we get the money.
Great. And then I have 2 similar questions here. How many people use the trauma room per year? And then in addition to that, how many get triaged to Vancouver? And why do some go to Vancouver and some stay in Whistler?
Oh, that's like 10 questions, not.
Yeah.
Well, so about over 22,000 people come to Whistler Healthcare Center every year. I think it was 1,000 something last year. I think Sandra has the numbers. I don't.
Yeah,
right
it's
in front of me.
1,500 patients are treated in the trauma room, is what it says here.
And when somebody gets sent out of Whistler, depends on whether whether or not we can care for them in our community. We do not have an overnight facility. So one thing that would determine someone leaving our facility is that they need care that is overnight. So that could be, somebody who needs, some pain management in a bed and nursing overnight, and then they might go to Squamish. But typically the patients that come out of our trauma room are either a trauma, long bone fractures mostly go to Lionsgate Hospital. Pelvis and spine go to Vancouver General Hospital, and neurosurgery, brain bleeds, that kind of thing. Multi-traumas, depends on what they are, go to Lionsgate, and a lot of our cardiac goes to St. Paul's as well. So each patient has their own story, and it's really a matter of them exceeding our capacity to care for them. And another thing that matters too is, what's the weather? Can we fly? Is there a helicopter available? There's so many variables involved, but really someone leaves Whistler because they need a higher level of care.
Great, thank you. And then there's just a comment here that the donate button on the mobile site doesn't seem to be working, just an FYI.
On
And
our
then
That's you,
on
Sandra.
our website?
yeah, on the mobile site.
Hopefully it's
Oh,
getting
okay.
jammed with all of you
Yeah.
donating right now on the side. I hope that's the story.
Okay, well, I know that we were doing some changes and there was a bit of a problem, and maybe there's somebody working on it right now. So that could be what the problem is. So that's probably not a good time, but yeah,
No worries.
by tomorrow we'll make sure that's working.
Great. And then next question, how much has Whistler Blackcomb Vale Resort contributed?
The Whistler Blackcomb Foundation has, they've donated 335,000. And we've also applied to the Cats Amsterdam Foundation, which is also related to the Vale Corp. We've applied for a loan or a grant of 75 to 100,000. But we're still waiting word on that. So we're not sure about that one.
Great, thanks. And the last question is, have you delivered any babies there?
Yeah, we do everything. I tell you, I don't want to deliver a baby. We actually
A lot of moms here.
Oh yeah, I know, right? There's some real local kids, I hate to tell you, that are born here. This is not where you want to have your baby, FYI, but yes, we do. I got to deliver a baby not long ago, which is never as fun when you're in a place without, a real hospital. But yeah, everything happens. We also have I don't know if you remember, if you're a mom, when you had your baby, they put them on this little isolette if you had one in a hospital. So that's one of the things that cause clutter that we have that goes in our trauma room. We bring this, the baby warmer, and that's got all the airway stuff for babies too. So a device called a NeoPuff, which is new, which helps to ventilate a baby that comes out not doing great, and warmer and all the necessary stuff for resuscitating the unexpected new deliveries here in Whistler, or unplanned, I should say.
Great, thank you. That's all the questions. So,
well, thank you everyone, and to Sandra for getting us to this venue. And it's nice to see you all. Thanks so much.
Thank you. Thank you, Sandra. Thank you, Fern.
Okay, thank you. Good night.
Night. Okay, so next here we are gonna speak to the Sea to Sky Thriver Society, and that is Nicolette. Let me just get her on here. There we go. There, perfect. Go ahead,
Okay.
Nicolette.
Hi, everyone. Thank you for having me here today. It is such a pleasure to be here and to also hear the pitches from the other two organizations. Now, Fern was talking about the acute trauma care that's needed and what's needed, but what I'm going to be talking to you about is chronic disease management and treatment, which is the opposite of acute. So chronic diseases are those illnesses that keep going on and on and on, and they actually cost our Canadian economy about $190 billion a year to manage those illnesses. So as like Fern did, what I had planned was for everybody to raise their hand if they have someone in their immediate family that it is suffering from a chronic disease right now, like heart disease or infertility or an autoimmune disorder or cancer or diabetes. There's so many different illnesses out there. So if you could just put up your hand, if you feel comfortable doing that, you might put up 2 hands for the 2 members or 10 fingers for the 10 people in your family that are suffering from all of these illnesses. And I can see there, without flipping through my screen, that yes, everyone we know, everyone has been touched by someone who has a chronic disease. So what is common about all of these chronic diseases that I mentioned is that they all have something that connects them, and it's that they're lifestyle diseases for the most part. And what most people don't know is that 95% of these chronic illnesses are caused by lifestyle risk factors that we actually have control over. So most people think that these diseases are genetic or that it's just luck of the draw when you get them. Most of my clients say, why did this happen to me? And then I have to explain to them, well, it's our environment, it's our lifestyle decisions that are contributing to the progression of these diseases. And so science, though, tells us something very, very different about these diseases, but this information isn't getting through to the general public. And it's that our diet is also responsible predominantly for the development of diabetes, heart disease, our cancers that we're seeing, and more. And so really the food that we put into our mouth 3 times a day, plus all the snacks, some of us are eating about 6 times a day, is responsible for up to 95% of these diseases, along with alcohol consumption, poor sleep, and stress, obviously. So I'm Nicolette Richet. I'm with Sea to Sky Thrivers Society, and we're located in Whistler. And I created this charity years ago to amplify the work that I've already been doing for more than 15 years, teaching people how to use food as medicine to reverse their chronic diseases. So, and I'm not just talking about manage, I'm talking about when, their physician actually says, you no longer need those medications, you no longer need that surgery because they have no symptoms of the disease at all. So many of the projects that we've already done include working with Indigenous communities to educate about traditional food as medicine, to grow community gardens. We've worked with many, many schools and athletic teams in educating the students about the difference between real food and the difference between the processed, refined foods that are in the grocery store, which I hate to even call food because most of these refined processed foods are not food at all. They're actually contributing to our poor health. So we've also educated physicians. So I travel around the world educating physicians, with my latest project being in China, educating over 600 physicians on how to use nutrition as a treatment for the reversal of chronic disease. So our organization is committed to providing education and training in complementary, alternative, and non-toxic treatments for cancer and other chronic diseases. We also strive to help the public better understand the science behind chronic degenerative diseases, how they are created, and how to weed through all of that evidence that I know you're all overwhelmed with around nutrition. What do I eat to make me healthy? And we teach the skills necessary as well to not only prevent the diseases, but more importantly, the stuff we like to do is reverse the diagnosed diseases. So we are educating people that when we hold up a potato, they don't even know what a potato is these days, because the only thing they've ever seen is a packaged French fry or a McDonald's French fry. So our organization is also committed to crushing the chronic diseases that are claiming the lives of so many people that we love in our communities. And we all need to really start getting excited, but also angry, because the evidence shows that the prescription medications that are being handed out for these chronic diseases, it's not working to tackle the chronic disease epidemic that's upon us. So let me give you an example of how our organization has helped people directly in our community. And I'm going to start off by telling you a story about Sarah. Sarah is a mom of 3 who lives in the Sea to Sky corridor. And about 3 years ago, she was actually going to claim her own life. She couldn't take care of her children anymore. She was binge eating, depressed, laying on a couch, couldn't go to work anymore. And on that particular day, she actually saw an announcement in the paper about the programs that we run. So she reached out to us and she ended up applying the work that we do and the programs that we do. And a year later, she had lost 157 pounds and she was off all her prescription meds. She no longer had diabetes. She was back to being a contributing member of her community. More importantly than that, she was able to be a mom again. And she wrote to us to tell us that story, that really our program saved her life. life. And I can give you thousands of stories exactly like that. So the Public Health Agency actually of Canada just reached out to us to ask how we can scale our programs across Canada, and particularly into remote and rural communities to build resiliency of our immune systems, because and this was all in light of the evidence coming out of the COVID pandemic. People with chronic diseases like heart disease and diabetes are most likely to die from COVID. And so they want to put a stop to that. And the Public Health Agency of Canada actually said to us that they know that getting Canadians to eat more fruits and vegetables is part of building that resiliency. And that's exactly what to do. So you can imagine how happy I was to finally get an email like that from a huge government agency. So the funds that we received today will be used to fuel that education, to do research and data collection, because I'm actually doing my PhD as well on these topics exactly, and to support our newest project, which is our 22 million strong tour. So 22 Million Strong is a Canada-wide tour where I have been training to run and cycle across Canada. So that's 7,120 kilometers, to go through all the major cities and also to meet with Indigenous elders, community members, politicians, physicians, and youth in over 35 major areas across Canada. I'll be doing this all in 75 days. So this tour is also part of the research that I'm doing with my PhD, where we'll also get to produce a documentary as part of the journey and of our findings from the research. Now, this is all about knowledge mobilization, because I can tell you that evidence that chronic diseases that your family members are living with and dying from, or that you might have, are reversible. And that evidence has been out there for over 100 years. I have well over 3,000 scientific medical journal published articles on my computer showing that this is true. But this message is still not getting through to the mainstream that food is medicine. So the data that I collect along this journey will be brought back to our communities in the Sea to Sky corridor, where Sea to Sky Thrivers then can then work with local organizations to create more programs, jobs, help governments develop policy, and will also help us get us further ahead in our funding. So most importantly, we can implement the systems to overcome the barriers to accessing clean, real foods, because food security is a major problem, not just in our local region, but all across Canada, and particularly in Indigenous communities. Currently, the healthcare system is not working. Our hospitals are overrun by people who are suffering from chronic disease. Our physicians are burnt out in the management of the diseases themselves, and people are still dying needlessly. And it's time that we bring the scientific evidence to the mainstream directly, so that our friends and family no longer have to battle these diseases, let alone pass away from them. So I've run and biked over 2,300 kilometers in the last 14 weeks as part of my training for this tour. And I was not a runner or a cyclist before 14 weeks ago. And since I started biking, people in our community got really excited. So we have over 120 local members who've started running, biking, walking, and switching their diets. And we already have results from people who are actually successfully reversing their diseases. So we'll be using this money for our 22 Million Strong initiative to raise awareness on a massive scale, starting with hosting these 35 community gatherings across Canada. And we're currently raising money to support the implementation of these programs after these funds are used. So we're looking at this long term, because it's actually a 10-year initiative. And we are fortunate because we are an enterprising nonprofit of the Green Mustache and Richer Health, two other companies that I created. So even when times like COVID hits and funding gets tight, we do have the support from these other organizations. But we are in the restaurant world, so you have to know money is tight, but at least we know that we can support the organization through dips in the economy and dips in funding. So we anticipate that this program will help 5,200 people directly through face-to-face conversations that we're going to be having. However, they're all going to be influencers in their community. So we know that we're going to be directly helping hundreds of thousands of people across Canada by getting this information out there. So what I do know from having done this work for over 15 years and helping many people, thousands of people globally successfully reverse their diseases, is that when one person can get off their medications and have a surgery canceled, we know that they inspire 10 other members of their family and community to also ditch the alcohol, eat better, get better exercise, ditch the stress, and also successfully reverse their diseases as well. So here's the best part. We're measuring these results directly, like I've always done. When their doctors give them the go-ahead that they are disease-free, when their doctors take them off the medications and cancel their upcoming surgeries. So my last example that I'll share with you is a woman in our community who had to lay off 20 of her staff because she was suffering from endometriosis that had her hospitalized. So she was no longer able to take care of her mom. She came to us. We helped her switch her lifestyle and her diet around, and she completely reversed her endometriosis, was able to restart her business and go back to being a mother. She's never needed one single prescription medication or surgery since coming to us. And that was over 7 years ago. So I'm going to leave it at that. And I just want to say thank you so much, everyone, for taking the time to hear about our organization and our 22 Million Strong Tour. It's really a pleasure to be here.
Thank you so much, Nicolette. Just going to give it one moment. And we're going to pop on with some questions here.
Yeah, our first one has popped up here. How much has Health Canada committed to scaling up your efforts? And are they partnering with you on this?
Yeah, that's a really good question. So with the program that they asked us to scale up, one of the big parts is they wanted us to focus on smoking cessation. So we didn't include that in part of our program. So we aren't working with them directly with that pot of money, but we are able to go back to them to ask for more. So they have $29 million to give to programs to us. And we actually met with them through our organization. We had a dinner with many scientists and with many funders. And so we're still in negotiation to be able to get that money.
Great, thank you. The next question is, did you just say that you cured endometriosis?
I said it, sorry, what was that?
Did you say you cured endometriosis?
Yeah, so I never like to use the word cure. It's not a really great word to use in the field of medicine. So what we can successfully say is we reversed all the symptoms of the disease. So when she went and got scanned and had all the follow-up tests, no endometriosis, no symptoms of the disease, no more pain, no more. She wasn't able to walk and even get from her bedroom to the bathroom. She now is an active member of our community, cycling, running, doing yoga, and her symptoms have not returned at all. And she's not the only person that I've helped with endometriosis get results where it's completely eliminated.
Amazing. Another comment here, love your work. Will you be willing to work together with current medical professionals to support their treatments with healthy immune boosting diets for patients?
Yeah, and that's the work that we do. We always work in alignment with, we're not against medicine, we're not against conventional treatments, but we always work with our clients' medical team to help them understand what we're doing on the nutrition side. And also because it's really important when our clients are on our program, their medications have to be titrated down very, very rapidly, because as their bodies heal, they cannot handle the level of insulin that they've been taking for the last 20 years. They can't take the heart disease meds. So the trauma room has been used for some of my clients who, when they went in because they didn't want to work closely enough with their medical doctors to get tests every day or every few days. So, they were taking blood pressure lowering medications, and because the therapy is so effective, it lowered their blood pressure too low. So then they ended up in the clinic only to have the doctor say, stop taking your medications, you no longer need them. So yes, we have to work very, very, very closely with all of our clients' medical teams.
Great, thanks. And is there a cost associated in working with your team, or how does that work?
So that's why we created the enterprising nonprofit, because we found that there's definitely a lot of people that have enough money to pay for our services on the for-profit side. So we have another company that's for-profit. But what we saw is that Indigenous members who suffer from diabetes at 4 times a higher rate than non-Indigenous members, a lot of them didn't have the money to work with us. So that's actually why I created the organization years ago. The other reason was because a lot of the young people in Whistler who were arriving here eating craft dinner and noodles every day, and then they would come to see me for their scleroderma, their autoimmune disorders. They also didn't have the money. So that's why we started the organization, was to be able to support youth and Indigenous communities who didn't have money for our services. So we provide a lot of our services for free. And of course, physicians who maybe were, say that, well, we've never been taught about food as medicine. And so they might not be willing to hear the information. But when we host seminars for free, it's amazing how we've helped educated thousands of physicians on this over the past 15 years, plus 4 years with the society.
Awesome. And then the last one here, your project is inspiring. What motivated you to run across Canada?
Yeah, great question. So I wasn't practicing what I preach on the movement side. So diet is predominantly responsible for these chronic diseases, up to 90% responsible. But on that 10% of the risk factors that we have to look at, moving our body is really important. But I wasn't doing that. I was stuck behind my computer, running our businesses and running the charity, as well as helping my children, but also helping my clients a lot. So sitting in a chair all the time. And so part of it was to actually get me out of my chair and to prove to myself that I can make those hard lifestyle changes. And so I never do anything really small or just a little bit. So originally I was supposed to ride and cycle down to California, but then COVID hit. So that's when we had to pivot. And my university said, well, why don't you cycle and run across a part of Canada? And I said, sure, but then it was hard to choose an endpoint and a starting point. So I just decided to go from east to west, or west to east.
Nice. That's amazing. Next question, can you define what an enterprising nonprofit is?
Sure. So when the Potluck Cafe Society out of Vancouver, I learned about it through them about 25 years ago. And so a lot of nonprofits, we're all in the same boat. We're all struggling for a pot of funds that need to be distributed. And sometimes that pot is really, really small. So by attaching yourselves to a for-profit company, that for-profit company can always step in and give funds when, for example, there aren't other funds available. So by having an enterprising nonprofit, one of the reasons why you'd want to have one as well is because sometimes there isn't an organization that is in direct alignment with your company that you want to donate to. So in the chronic disease treatment realm, there wasn't another charity that we knew of that is actively working to reverse chronic diseases. Most nonprofits are only there to get people to the doctor, to be diagnosed, to get onto medication, to manage diabetes. We wanted to come at it from the angle of reversing disease. So that's why we created the nonprofit.
Great, thank you. And the diet of whole foods clearly is what human bodies need, but is there a risk for your clients to shun conventional treatment and risk their health?
Yeah, and they never have to shun conventional treatment as well, because what we do, it's a weaning off process. So as they change their diet and start to eat healthier, and their body actually starts to, our bodies are designed to heal themselves. So once they have all of the metabolic nutrients to be able to self-heal, then what happens is their bodies no longer have a need for the medications. And that becomes very evident when the insulin that they're taking is too much, when the antidepressants start to show negative effects. They're not actually helping, but they're harming. And that applies to all the drugs. My clients who can't get pregnant, they no longer need fertility drugs. Most of them don't even have to go get it. And so we don't ever shun conventional treatment at all. But in some cases, they don't need the conventional treatment, as in the case for my very, very first individual that I had ever heard that reversed cancer successfully with metabolic nutrient therapy. And that was 22 years ago. He was 72 years old at the time, stage 4 cancer. No conventional treatment was available to him. The doctor said it would not work. So he actually did this therapy I learned it from him, and he ended up living 22 more years and died at 94 years old. So he was able to work up until the last month before he died. And I mean, that's an example about being able to give people back their lives, allowing them to be contributing members of their society, and where he could have done conventional treatment if it was offered, but it just wasn't even offered to him. So he did resort to using this crazy, quacky, food as medicine concept, but it bought him 22 more years of life. So yes, we love conventional medicine when it's needed, and especially in acute care. But when it comes to chronic disease management, it's proven that it is not working to actually eliminate these chronic diseases.
Awesome.
Great, thank you. That's all the questions. Thank you for your time.
Nicolette, I just wanted to ask one thing. Can you just clarify, the donation tonight would go towards the actual tour, so the costs associated with the tour that you're doing, or is it going to go to something else? I just want to confirm that for everybody, where the funds would actually go.
Yeah, it would go directly to supporting the tour and to supporting the gatherings that we're going to be doing with the 35 communities across Canada.
Perfect. Okay, thank you so much.
You're welcome. Thank you.
All right, so just to go over, we have 3 amazing organizations. Thank you so much to everybody who presented and sitting in the hot seat there. So just to go over, we have Pemberton and District Public Library Association, and they are looking for funding for their Creation Station. We have the Whistler Healthcare Foundation, and they are looking for funding for their trauma room update. And then finally, we have the Sea to Sky Thrivers Society, and they're looking for funding for that 20 million strong tour that Nicolette is doing there and all the stops along the way. So I'm just going to, it's my first time doing this breakout room thing. So I'm gonna just pop our speakers into this room. Sorry, bear with me.
I'd like to vote, please.
Yeah, I will let you vote. And there we go. So, perfect. Hey, did that work? Did it pop them into the other room? I think so. All right.
Yeah, I think so.
Pop up the poll here. There we go. So there you go. We'll give you everybody about 2 minutes if you need some time to put in your poll results there. And once we've got everybody's, we will move on. Andrea and Courtney, I'm just looking for you. Sorry. There you are. So you should be able to vote now. Let me know if you can't and just text it to me.
I was able, thanks.
Perfect. Anyone who hasn't voted yet? I'm showing one more person in here. Oh, it might be Amanda. I can see that she's not at her desk there. Have you voted, Amanda? Okay. Okay. Somebody just texted me their last vote, so I will end this poll. Go. And then I'll bring everybody back in and we will make our announcement here. All right. I'll just let Emma, Nicolette, and Sandra come back in. Sorry, we're running a little bit long, everyone. I'll try to wrap up really quickly once we make this announcement. All right. we have everybody back in? I believe so. Man, with so many people here, it's hard to find people. There we go. Okay, so drum roll. Blah, 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 blah. Our donation of $11,200 this evening will go to the Whistler Healthcare Foundation. That's my super technical screen way of doing that. Pop this here. Go.
Oh, am I unmuted now?
You are unmuted now.
Oh, well, thank you, everybody. I appreciate, all your support, and thank you to the other applicants. That you both had great presentations and good causes, and I'm very humbled. It's great. Like, it's really good. We've had amazing support from the community, and we continue to have that great support. And I'm pretty confident that come the spring, we'll be able to get started on the project. And the next time, hopefully no one ever gets to go and see the actual finished product.
True.
So thank you very much. It's great.
Awesome. And thank you so much to Nicolette and to Emma. Thank you for coming on here. Again, I'll reach out to you and I'll get a donation link, and we'll include that to all of our members. So if anyone feels that they want to place a donation as well to one of these organizations, you are more than welcome to. So again, a reminder, if you haven't sent your payment donation in for tonight, please do so. In fact, email transfer to info@100womenwhistler.com, and that's 100. Please do that tonight if you can. And then the last thing that we were going to talk about was we will be wiping everyone's nominations that we've made so far. We're going to wipe that out for 2021, and we're going to have everybody who's a current member nominate an organization. We've been through almost all except for maybe 3 of the nominations we had put forward before. So that's great. So a little bit of homework over the holidays. I kind of just want to put out to our members to ask your families, ask your friends, maybe do a Google search, a little bit to find some new organizations in our community that are looking for funding for a project or something of that sort. It doesn't have to be, this was a question I had quite often face-to-face when we had our meetings. It doesn't need to be an organization that is a registered charity in order to give us the tax receipts if they can umbrella underneath another organization. So we have that with the Lilwat Nation. They umbrellaed under another organization that was able to give tax receipts, and that's how they were able to be nominated. And we've had a couple other organizations as well that someone has nominated, and we've reached out to them and asked if they could find an umbrella organization, and they have. So my request to you is to please do a little bit of digging and asking, and maybe let's just find out some of those organizations that don't just come up on the search for registered charities in our community, and see if we can find some other people that are looking for some help. And then as well, whatever else you've got, if you've got another organization that hasn't made it to our list yet, that'll be great too. So that'll come out in January of 2021. Look for that via email. Other than that, with our donation today, we've had 7 meetings, so 7 hours respectively. This one's a little long. We have donated $82,800 to the community. So yay, everybody. All right, so you are free. Oh, wait, I want to try to get a photo. Please bear with me because I'm not, okay, I've got almost everybody up here. Don't laugh at me, but I'm literally just gonna hold my camera up. So everybody just try to look happy, like really happy to be here. 1, 2, 3. Perfect. Thank you. Okay, everybody have a great night. You can